I'm Shobeiri. I'm a urogynecologist and I am the vice chair of gynecological subspecialties at Inova Women's Hospital. There are muscles in my pelvis and your pelvis that are holding everything together, preventing our insides from falling out. For women, that means their uterus, their ovaries, their bladder, their rectum. So these muscles are very intricate the way they work together. And as long as they work, life is good. Patients urinate, pee, and have bowel movements and have intercourse without any difficulties. But when these muscles don't work for one reason or the other, then life becomes miserable. The pelvic floor ultrasound is very easily done. The way we do it is a three-dimensional pelvic floor ultrasound. You literally push a 3D button and it takes 60 seconds, and what it would do is give you a 3D volume of the patient's pelvic floor. So the pelvic floor ultrasound has been very useful for delineating issues with muscle injury after childbirth, perineal injury after childbirth, and there has been a lot of vaginal mesh complications, and no other modality can see the vaginal mesh. CAT scans, MRIs cannot see it. So ultrasound is the only modality, and the three-dimensional pelvic floor ultrasound is very good for that. Additionally, we use pelvic floor ultrasound for looking at vaginal masses and cysts, and also just conditions such as prolapse, incontinence, urinary incontinence, fecal incontinence. So we really, in our hands, we use it for all the pelvic floor disorders. So the patient doesn't need to do anything in advance before they come and see us. We have a lot of patients who come from other states or out of country, and the way that they walk into the office, we just do the ultrasound for them. It literally adds 1 or 2 minutes to their visit. And the amount of information it gives us is just amazing in terms of their management, trying to see what we need to do. One thing we have difficulty with is patients' knowledge of their pelvic floor anatomy. So as they are getting the ultrasound done, which takes a minute, after the ultrasound is done, we basically have them look at the images with us, and we go through the images and tell them where the problems are. So it's very educational, and the patients really appreciate just seeing their own pelvic floor and see what the problem is. I'm Shobeiri. If you think you have any issues with your pelvic floor, or if you think you may require pelvic floor ultrasound, please call our office for an appointment.